Yes.
Hi, I'm Mikaela. I'm going to be your nurse today.
Hi.
Are you okay with me performing a respiratory and cardiac assessment on you today?
Yes.
And videoing it?
Yes.
Okay. Could you please tell me your name and date of birth?
Yes, it's Joe Stevens, 8/2/1947.
Okay, good. Do you have any allergies?
No, I don't.
Okay. Do you know where you are?
Yes, I'm at Bearcat Hospital.
Okay, do you know why you're here?
I'm here for an assessment.
Okay. Do you know what year it is?
It is 2022.
Okay. Patient is ANO times 3. Okay, so I just have a few questions to ask before I begin the assessment. So, are you experiencing any chest pain or tightness?
No.
Any shortness of breath?
Yes.
When does that occur?
It occurs whenever I smoke.
Okay, and how often do you smoke?
I smoke about every day.
Okay, so does anything make it worse?
Yeah, when I smoke a lot.
Does anything make it better or relieve it?
Yeah, when I don't smoke.
Okay.
But I love smoking, so.
Okay, so it's happening quite frequently because you are smoking?
Yeah, it is.
Okay. Are you experiencing any fatigue or lightheadedness?
Yes, I'm experiencing fatigue.
Okay, and is that does it have anything to do with you smoking? And with the shortness of breath?
I think so. Yes.
Okay. So how often does it occur?
It occurs about every day. Sometimes I feel super tired, but sometimes it's like, okay, I'm just a little bit tired.
Okay. Does anything make it better or worse?
Laying down.
Okay. Do you have a history of any lung or cardiac disease?
Yes, I have COPD. Yeah.
Okay. Are you currently taking any treatments for that?
No.
Okay. Do you remember when you were diagnosed with it?
I'm not sure. About like 20 years ago.
Is it affecting your daily life?
Yeah, I get tired and the shortness of breath along with the smoking. I think so.
Okay. Do you ever have to get up during the night to go to the restroom?
No.
Okay. Do you have any swelling in your legs or feet?
No.
Do you have a cough?
No.
Okay. Do you have a history of hypertension, high cholesterol, or diabetes?
No.
So you are a smoker.
Yes.
And you did state how many times you smoke, which is quite frequently.
Yes.
And are you up to date on your immunizations, like TB and influenza? And have you gotten your pneumococcal vaccine?
No, I haven't.
Okay. So now I'm just going to start my assessment on you. So physical appearance, well dressed for the occasion, appears to be very calm, cooperative, very attentive, speech is clear and concise, patient is ANO times 3, mood matches affect, and she is sitting erect and on the side of the bed. So now I'm going to begin to inspect your posterior chest, okay? So first part I'm going to inspect, just look at your chest shape. So the shape is normal and it appears to have no abnormalities. And so it appears to be symmetrical. So now what I'm going to do is I'm going to test for symmetry. So if you could breathe in and out for me. Okay, chest expansion is symmetrical bilaterally. And her ease of breathing seems to be very calm and soft-toned. Now I'm going to check for tactile firmitus. So whenever you feel the palm of my hand on my back, please say 99.
99. 99. 99, 99, 99, 99, 99, 99.
Okay, good. No abnormal tactile firmitus sounds. Everything is normal. So now I'm going to auscultate and listen to 12 spots. Normally you would check for 18, but for the sake of this assessment, I'm only going to do 4. So every time you feel the diaphragm on the back on your back, please breathe in and breathe out for me, okay? Okay. Breath sounds are mostly clear, but because of the COPD, I can hear some slight wheezing and a little bit of crackle. But most of all, it is mostly clear, and there are some advantageous sounds, as I just mentioned, but that's normal considering that you do have a diagnosis of COPD. So now I'm going to come around and I'm going to inspect your neck. So if you could just raise your chin a little bit. Okay, so trachea appears to be midline. So now I'm going to palpate your carotids, make sure that I can pick up on the rate and rhythm. Okay, +2. +2. Okay, now if you could, I'm going to listen with the bell of my stethoscope to check for any murmurs. If you could just breathe in and then breathe out for me and then hold your breath, okay?
No, it's because I was, but I was like, it's not even that low. Like, I'm literally just looking. I'm not like doing anything. Wait, oh, yeah, we'll laugh. I had to record. Yeah,
Okay, good. I didn't hear any murmurs. So that's a good finding. Okay. So now I'm going to need to check for JVD. So if you could please lay down flat on the bed. And just raise your head up a little bit for me. Okay? And so I should not be able to see any pulsations or anything like that underneath the skin. I do not see any presence of that. And I'm going to raise the head of your bed a little bit now. See if I see any changes. And I do not see any changes. So no abnormal findings and no presence of JVD. So that's good. So if you can please sit back up for me and come to the side of the bed. Okay, so now I'm going to inspect your anterior chest. The shape appears to be normal. As with the posterior, the color appears to be evenly distributed, no pallor present. You appear to be breathing normally, no signs of respiratory distress. So now, if you're okay with it, I would like to check the symmetry of your chest wall, so I'm going to have to come right under here. If you could please breathe in and out for me. Okay. Chest expansion is symmetrical bilaterally. And then now I'm going to check for tactile firmness again. As you did before, please say 99 whenever I put my palm on your chest.
99. 99. 99. 99. 99. 99. 99. 99.
Okay, good. Now normal findings for tactile firmitus, normal findings. So now I'm going to auscultate 10 spots on your anterior chest. If you could just breathe in and out for me like you did before. respiratory sounds appear to have the same kind of sound as the back ones did, which is a slight wheezing and crackling sound due to your COPD, but that is normal. But otherwise, they are clear with some partial adventageous sounds. So now what I'm going to do is I'm going to listen to your heart. I'm going to use my diaphragm first, and then I'm going to switch it to the bell to check for any murmurs, okay? So same thing as before, just breathe normally. Now I'm checking the aortic, pulmonic, Erb's point, tricuspid, and mitral. I can hear the S1 and S2 sounds. Now I'm going to check for murmurs. Very clear heart sounds. Okay, so now I'm going to check your apical pulse and your radial pulse, and I'm going to compare them. So I'm going to put the diaphragm back on the lower part of your heart, and then I'm going to put my fingers on your radial pulse, okay?
Okay.
And I would check this for a minute. So your heart and your radial pulse align with each other, so that's a good finding. Okay, so now all that we have to do is I'd like you to lay back on the bed, and then I'm going to assess your upper extremities and your lower extremities, okay? Raise the bed a little bit. Okay, so noting for temperature and texture, her skin is warm, it is dry to the touch and smooth to the touch, no present abnormalities that I notice, no presence of edema or swelling or any excessive redness. I'm going to check your radial pulses and kind of make sure that they are both the same. Okay, radial pulses are equal bilaterally, about 2+, that's a normal finding, so that's good. Then I'm going to check your capillary refill. Okay, capillary refill of less than 2 seconds, that's a good finding. So now I'm going to look at your lower extremities, okay?
Okay.
I'm going to do the same thing. So, temperature and color. Temperature is warm, color is evenly distributed. For race, it is dry to the touch, no presence of edema or swelling or any excessive redness. So now I'm going to need to check your posterior tibial pulses and your dorsalis pedis pulses and your capillary refill. So is it okay if I take your socks off?
Mm-hmm.
Okay, so posterior tibialis pulses, 2+, normal, and then dorsalis pedis pulses, 2+, normal finding, and then since you have a couple toes that don't have nail polish on them, I'm just going to use those, okay? Check for capillary refill. Okay, good. Capillary refill is less than 2 seconds, so that is a good finding. And I believe that I am done with my assessment. So is there anything else that you need before I leave?
No, I'm good.
And thank you so much for cooperating with me today. Are you at a comfortable height?
Yes.
Okay. I'm just gonna lower the bed down. Side rails up, 2 of them up. Bed is locked. Okay, call light. Okay. If you need me at all, just let me know. Press the button. I'll be right back in here, okay?
Okay, thank you.
Thank you so much.